I think the massive difference is they're not speaking to you like you're a child anymore. They're not going to be very animated. They see a lot of patients, so they're not going to recognise you straight away. They mightn't recognise you the third, fourth time round. I suppose they're going to talk to you like you're an adult. They're going to treat you like an adult, and they're going to want you to participate as much as you can in the clinic appointments, because it's your time that you're there for, and they want you to get the best out of it. So you have to be willing to participate, and like, there's no point of just sitting in a waiting room for 20-30 minutes and then wait to see a doctor and then not talk to him. So prepare to answer his questions, prepare to engage with them. I think it's very important. It's not up to your parent anymore, it's up to you to sit down there and talk and to ask questions.
Well, with the child services, everything was covered by the one doctor. I always went to him, and that was it. If I needed to go to see the dietitian or the nurse, you know, I'd go see them on the same day with the doctor. When I went into the adult services, it was just a nurse. And that's it. I mean, you get her number and you get her email, and that's all. And then every 4 months, I think it is, you meet the doctor, which is different. You know, the doctor's not there when you're meeting the nurse, so that was different. And on the first day,
well, if I'm really honest, when I went to the first time to the adult hospital, I thought it was so cold and so harsh, as opposed to children's hospital where it's so warm, you know everyone, and like I talked about going up and visiting the people in the ward that I was staying in all the time. I just thought it was a really cold experience, and I know that's not very nice to say, but I think that's because I was, not in a bad way, but with my mum. I think the doctor wanted to talk to me and see the patient, not have my mum answer all the questions, which is hard for parents to deal with, but it's the reality. Like, I'm the adult apparently, so I have to deal with it. And then when I went back for my second one, it was completely different, entirely different. Like, I even told my mum how, like, it was just such a completely different experience. And I went into the nurse, I got all the information I needed to get, everything was explained to me, and then when I went into the doctor, I just felt that he was completely more different. I know he probably wasn't, but it was just mentally, for me, it was just so much more different. I was so much more relaxed, and I understood everything, and he went over everything with me. He was really, really happy. It was just felt like a completely different environment. But I suppose that's because I was so much more prepared and I was ready this time, which I think is really important.
It's a different environment, you know. It's not like when I was in Crumlin, like, I was walking around like all the little kids like that, and I was this like 18-year-old, like, you know, you rarely see that in the children's hospital unless there's like people with long-term illnesses. So on my ward, like, generally when I was in, I'd always be one of the eldest, so it's really weird going from one of the eldest to one of the youngest in the hospital, like walking around. And, you know, there is, like, you know, people are older than you, and that's gonna, like, you know, I'm only 19 now, but at the time I was only 18, like, I had to accept, like, you're gonna be one of the youngest now. But no, it did take time to get used to, you know, going in a different environment, but now, like, I'm completely used to it now, and it's just, like, I wouldn't say it's a home from home, because I don't think when you're in a children's hospital it is different, and, like, you have your play specialists and stuff, so there is a more, you know, kind of loving environment, if you get me. But it's not to say that the staff aren't lovely, because every single member of the staff are absolutely lovely and would go out of their way for you. But like, I don't feel like that home to home just yet. But to be honest, I don't want to feel that, because I don't want to be in hospital enough to have that home to home.